Hello, I'm Mike Tremblay, the author of the paper Building Worldly Insights for the journal Healthcare Management Forum. The paper is an introduction to some of the healthcare management issues for people interested in learning from other countries. It is not uncommon to look at other countries when we want to learn something new. In that endeavor, we tend to choose like-minded or familiar countries. Familiarity, or what is called the availability heuristic, means we tend to favor what we understand and what seems familiar, and discount what is unfamiliar. Indeed, we often think our own country's healthcare system is the best and explain away poor performance. This hubris means that lessons from other countries may be ignored. What I wanted to do in this paper is select two different and broadly unfamiliar types of countries for potential learning and application to Canada. The first are small ones, which are often islands. The other are post-conflict countries, or those emerging from conflict. Let's look at each in turn. Small and island countries, for the purposes of the paper, have a population under 5 million. These tend to have very high standards of development, using the UN's Human Development Index, and include countries like Monaco, Singapore, Iceland, Bhutan, and so on. The island states experience degrees of insularity, being surrounded by water, and this leads to physical remoteness. All small and island states have limited institutional capacity, as while often quite wealthy, they have small populations and small economies. This means they are usually dependent on a few resources or industries, for instance, minerals or tourism. This also means they have trouble diversifying in the face of economic or social changes. They are increasingly subject to climate change, as many are at or near sea level. The smaller country size means they cannot provide the fullest range of healthcare services. It is not uncommon for smaller countries to have arrangements to access specialist healthcare from larger countries, which of course involves travel for the patients, possible delays in accessing treatment, and follow-up. The healthcare and medical professionals will also have fewer opportunities for professional and career development within the country and will need to access advanced training in other countries. More generally, this means that smaller countries usually are unable to meet their labor force requirements domestically and are therefore dependent on neighboring or other countries. This also means that their need for healthcare professionals largely depends on immigration. Post-conflict countries, on the other hand, are in the main at low or very low levels of human development and include countries such as Lebanon, Sudan, Afghanistan, Congo, and so on. Healthcare systems in post-conflict countries invariably will have collapsed in some form. This ranges from deliberate bombing of hospitals, as in Syria, or the flight of the population from conflict, and this includes healthcare professionals. Conflict leads to a considerable amount of resource diversion from healthcare to military and combat priorities. This also means that when conflict ceases and the country begins the process of recovery and reconstruction, resource use needs to be redeployed to non-military purposes. As well, leaders who have experience in combat, civil war, or the black market need retraining or replacing, something not always done well. Access to leadership and healthcare expertise is sparse and frequently depends on donor aid. Donors often focus on their own interests and not necessarily the needs of the country, leading to further misdirection of resources and inappropriate priorities. In addition, supply chains will have collapsed, so shortages of medical and pharmaceutical supplies are common. Recruitment of healthcare professionals can be challenging given the instability that comes with the recovery process itself. Economic sanctions have a perverse consequence by making it hard for countries to afford medicines and supplies, despite these areas usually being excluded on humanitarian grounds. So what about Canada? As most provinces fall within the definition of small, the challenges of scale are relevant. This is because healthcare is constitutionally organized at the provincial and territorial level. Newfoundland, for instance, trains as many doctors as Malta, but loses perhaps 2/3 of its graduates to other provinces and must in effect recruit from outside the province, a type of immigration. Small countries must make do with their national economic wealth to afford the healthcare system they have. Canada redistributes money from other provinces to equalize as best as possible healthcare, but despite this, significant interprovincial variations exist. While conflict of the sort I've described is unknown in Canada, there are under and poorly served populations who suffer the consequences similar to conflict countries. These emerge from failed bureaucracies and failed public policies, which typify failed post-conflict states. In the paper, I suggest that Aboriginal healthcare in Canada, and perhaps in other countries, is failing in the way that is evident in post-conflict countries. A critical factor in drawing this conclusion is the apparent need to acknowledge institutional and policy failure, which are preconditions for reconstruction and recovery in a post-conflict country. You do not rebuild what doesn't work. So the management leadership issues, I think, are these. Both small countries and post-conflict countries offer examples of fresh thinking in healthcare. Both suffer from resource constraints, both must work with what they have, and both must design their healthcare system on that basis. Both illustrate the need to calibrate policies to the on-the-ground situation and be open about the sources of bureaucratic and policy failure. Now, to finish off this summary, the paper presents a comparative analysis of Malta, Brunei, and Newfoundland, as well as a case study from New Zealand on how they've dealt with management shortages. There is a first-hand account of the situation in Libya. If this area interests you and you want to know more, I have additional information on resources on both small and island countries and post-conflict countries. I hope, too, you have found the paper of interest and value to your own management development and learning, and I hope this video is helpful to you. Thank you very much.